welcome back to another episode of the Rick and Danny Show. Danny, how are we feeling today? You ready to rock and roll?
Feeling real good today, Rick. Thank you for asking. Ready to
No
roll.
problem. No problem. I was looking at the topic set list here that Brandon's provided, and I know we just had two back-to-back great episodes with Dr. Ed about a topic I know little about. And so I think Brennan was like, well, let's have another topic that I don't know very much about. And, that way I could really just keep contributing greatly to the intense medical discussions on this podcast.
You
So
can
Danny, why don't you,
kick back and
I like to keep
relax.
you humble. I like to keep you humble.
that's a very easy thing to do. So yeah,
Yeah.
Danny, why don't you tell the listeners what we're going to talk about, and I'll hang up and listen.
Well, Rick, I'm happy to take the lead on this one. We're going to talk about iron deficiency anemia, which is a hot topic. It is a very common consult. Yeah, exactly. Very common consult in hematology. We see quite a bit here out at our Beaches location, and I'm sure every other location in our practice sees quite a few consults for iron deficiency anemia. Now, it got some more press lately because there was an article that came out, and I'm not sure, I think they did some sort of a population study, which looked at the underdiagnosis of iron deficiency in the world. And I think that they estimated some, crazy high number of individuals, hundreds of millions, maybe even a billion patients who have iron deficiency and are just unaware of it. And is that real in our practice, that patients can be iron deficient and not know it? Certainly that's the case. We see patients sometimes who are asymptomatic with iron deficiency, and we have patients who are highly symptomatic from their iron deficiency anemia. And I say iron deficiency and I say anemia sometimes because patients can be iron deficient and not have anemia. Anemia is defined by having either a low red blood cell count or a low hemoglobin level. Hemoglobin is part of red blood cells, carries oxygen in the blood, and we sometimes encounter low hemoglobin levels in males and females. And when the cells are small in size, they're usually small and what we call hypochromic, where the cell under a microscope looks pale. We think those patients probably have iron deficiency anemia. That's a common presentation. So when I look at a CBC, which is a complete blood count for a patient coming in, we look at the hemoglobin level, we look at the size of the red blood cells, and we look at something called the red blood cell distribution width, which is kind of a percentage of how much variation is there in the red blood cell size. And we can kind of come up with differential diagnosis of what the patient may have as far as the cause of their anemia, if they're anemic. Now, iron deficiency it's common. It can be caused by many things. We only get iron through our diets. Or if, you take a supplement, certainly you can get iron through supplements or fortified, grains or foods. So patients who either have inability to absorb iron in their gastrointestinal tract, iron's absorbed in the small intestine and a small amount in the stomach as well. And some patients have diseases or, say, post-operative states that make them absorb iron at a much lower rate. And those patients are at risk of developing iron deficiency and anemia. And then the other big population are those patients who have either chronic bleeding or acute bleeding that lead to loss of iron, and they don't replenish their iron, stores to help build blood cells. So those are the two most common reasons that patients become iron deficient and can lead to anemia.
Do you
Go ahead, Rick.
Dan, do you think that that article you referenced at the beginning was sort of this sheer number of things? Do you think that's a combination of real world changes in our life? Is it because people are living longer? Is it because we're just better at picking it up? Is it a combination of everything? What's your take on sort of that?
I think it's a combination. I think, we tend to see a lot more females with iron deficiency. Um, it tends to be more common in menstruating females, females that have, and you don't have to have heavy blood loss during your menstrual cycle, but if you have chronic blood loss and you're not replenishing that iron with good iron-rich foods or a supplement, then, all women can be at risk of developing iron deficiency. I think there are certain areas in the world where iron rich foods are not as plentiful, and maybe iron fortified foods aren't as plentiful. And that plays a role. And I think maybe diet fads play a role too, because, I think since we've been adults, there's been many fads out there and many recommendations about to stick to a vegan diet, to stick to a vegetarian diet, a pescatarian diet, all these different things that might have some health benefits in certain respects, but may be somewhat nutrient deficient in other respects. So I think all those play a role. So when coming, to see a hematologist like myself, we counsel the patient on what are the ways we can restore the iron in their system? How can we get their iron levels built up safely? And those options include oral iron, iron in your diet, and then there are forms of iron that we can give intravenously as an infusion for patients that are severely iron deficient. We always try to come up with a reason for their iron deficiency. So, it's not really good practice to see a patient and say, oh, you're iron deficient, just get on oral iron, or let me order an IV iron infusion for you, and then it'll all be better. We need to identify, well, what led to that iron deficiency so that we can hopefully prevent it from occurring again, or at least understand what is the trend going to be over the next several years. If it's a young female with menstrual blood loss, we counsel them to talk to their gynecologist, look for ways to, if they can, reduce the amount of bleeding they're having, or, if we can keep up with lab work and monitor their blood more frequently so that we can be a little bit more proactive about treating iron deficiency before they become anemic. That's one thing. An older patient who may come in with iron deficiency, any patient who is in a female that's postmenopausal, or a male patient who is in later stages of life, if they're iron deficient, you need to find out why and usually have them see a gastroenterologist. And we always rule out occult bleeding in the gastrointestinal tract, and we rule out tumors too, because tumors that show up in the GI tract, esophagus, stomach, colon, other part of your intestine, tumors tend to bleed in those areas, and that can lead to blood loss or iron deficiency caused by blood loss. So we always want to investigate the cause of iron deficiency.
Well, makes a lot of sense. I mean, it just seems like you could pick this up at so many people, and how, like you said earlier, how many people are just walking around probably with some baseline,
and symptoms,
maybe not full frank anemia, but some low iron store or absorption issue.
And I think your point of like, why is it maybe underdiagnosed? Well, if you get a complete blood count, which a lot of primary care providers get a complete blood count at least once a year on their patients, you might not see anemia, you might not see a change in the red blood cell size, and patients can still be iron deficient even without those changes. It usually takes more severe forms of iron deficiency to lead to the blood cells changing size and shape, and then that leads to anemia over time when the iron stores are deplete. So what we do when we see patients with iron deficiency is measure kind of what is their iron deficit, try to calculate how much iron they need to restore to a normal good level, so that they can build the blood that they need and feel better, and alleviate symptoms like fatigue and decreased concentration and trouble sleeping and headaches, and sometimes palpitations, their heart flutters or irregular heartbeat, and restless leg syndrome. And all these symptoms are possible with iron deficiency and iron deficiency anemia. But they overlap with other diseases and disorders as well. So when I counsel patients, I tell them, some of these symptoms may get better, probably some of them will, but they may not all be alleviated by just the iron replacement. So we just need to see after we get them back to normal range. So I think, the bottom line for iron deficiency anemia is getting the appropriate labs along with the complete blood count. You need to check iron levels. Iron levels are pretty easy to order. A hematologist, primary care provider can order those. And then we determine how much iron we need to replenish to get them back to normal levels so that they can produce adequate amount of red blood cells and feel better. And, we follow patients all the time with this diagnosis and are very comfortable treating patients here. So,
Thanks, Danny. I know that's something that you guys see a lot of, and, it's interesting to me to just understand more of the scope of the problem, which is obviously quite large and keeps you busy.
It keeps us busy. I think the majority of patients that come in with symptomatic iron deficiency anemia require iron infusions, and they're generally safe to give in the office here. Our nurses supervise them as they're getting infusions. And the only major risk of an iron infusion is having an allergic reaction to it. The most frequent, report of allergic reaction to IV iron is about 1 in 1,000 patients treated. It's probably less frequent than that, but we do monitor closely. And then I counsel patients that about, week to 2 weeks after the infusion, they may start to see improvements in their symptoms. And then we continue to monitor them afterwards. And the benefit of IV iron is that you don't have to deal with the gastrointestinal side effects of oral iron, which can be constipation, indigestion, nausea, those type of symptoms with oral iron intake. So there are definitely certain patients that are benefiting from getting IV iron over oral iron. And those are the patients we see here in clinic and guide them on what the most appropriate treatment is.
So I think that's super helpful. Thanks for taking the time to go through that. I think that hopefully helped clear up for the viewers and listeners out there.
So yep, happy to do it, Rick, and we'll see you next time.
Take care.
Bye.